x-rays. As you get to look at more, you'll be able to pick up on more information that you normally would not have known, but you have to take the time. Arthritis is a joint problem initiated from mechanical abnormalities. X-rays show that by midlife, 50% of us will be affected. Why? Why is it already by midlife they're affected? They have arthritis in the joints that is seen on X-ray because we're not doing what we're supposed to do when they're in their 20s and 30s. As doctors, we can't just say, okay, my knee, I hear it grinding, and you know what's going on, and then you prescribe NSAIDs. Some of the problems that we're seeing in our patients is that these patients did not have good footwear. They were not instructed properly on the forms of exercise that will help them. And the emphasis was on appearance rather than mechanics. The other thing that's happening is that we have a lot of obesity in our country. First of all, the foot has a certain structure. It's called a truss, and it has 3 arches in it. And this foot right here has to have a certain amount of strength in order to maintain the position and the movement pattern through walking. Now, if you put on 30 pounds, but you don't increase the strength and power of the foot by 15%, then something's going to give. That's your foot. It will drop and lock. So if you're gaining weight or your patients have gained weight, that's a perfect opportunity for the foot to have problems with the foot. The other thing what we had mentioned before is that if we do have pain in the body that we prescribe the medication, it can actually be a negative effect. According to the researchers at Rush Presbyterian St. Luke's, they did a study on unilateral knee pain. What they found was that when they prescribed the medication, they actually had taken some of the weight off of the knee before they had the medication because the pain is a warning signal. It's there to tell you something's wrong. And I always use this analogy when I say, okay, we're driving down the road and I